All right. Uh, Good evening, everyone, and welcome to ATP Live Monday. I am Bimisola Boyde, and it's my pleasure to be here today. Um, okay. So, welcome, whichever platform you're joining us on. And let's all just share the video first and invite everybody. I'll do the same as well. Luckily, I'm live in our Ask the Paediatrician proper today. Thank God. It's always a nightmare when we're not live in the group. Okay, so welcome everyone. Welcome. Please share the video, invite your friends, invite family to join us. Thank you, those of you on Instagram. I can see you. Welcome. I'm just going to share the video first and then we can start. But if you have any question, feel free to drop your questions to our Facebook group. All right. And happy new month to you all. Welcome to December. It's the most wonderful time of the year. All right. Yeah, it's also my birth month, so December is the most wonderful time of the year. All right, so you're welcome. And then I'm just sharing the video so that people can see and hear us. Well, I can see Fama very consistently here. Thank you so much. Um, I'm just going to share to our groups. Uh, just give me a couple of minutes. Uh, and today is the World AIDS Day, so I will talk a little bit about HIV/AIDS. I know it's no longer hot button topic like it used to be in those days, but we should still remember it's still not completely disappear. So we'll talk a little bit about it. Welcome. Um, okay. All right. I guess I'm almost done with all the sharing and the pinning. Okay. Good. Just one more group to share. TP family. Happy new month. Happy December, everyone. Welcome. Okay. I can see the share. Didn't I share? Okay. I think I may not have shared to the. Okay. Just a minute. I'm looking for one of our groups. I think I didn't pin it there. I can't seem to find it. Why is it not showing? Okay, finally have seen it. Okay, good. So, good evening, everyone. How are you? Happy new month. Happy September, December. Welcome to the most wonderful time of the year. My name is Bimi Salaboede. I'm a pediatrician, and it's my pleasure to be here today to answer any questions that you may have about the health of your children. And like I said, today is also the World AIDS Day, and so I will do a little bit of talking. And even though people may wonder what concerns pediatrician with AIDS, actually, pediatric HIV/AIDS it's an issue with us, and we definitely need to talk about how to prevent our children from getting HIV/AIDS obviously from their mothers. So I'll dab that into a little. But if you have any questions about the health of your children, feel free to ask. I have just 1 hour to answer your questions. So feel free to ask your questions and I will do my best to answer them. So whichever platform you're joining us from, on Instagram, on Facebook, on YouTube, you are warmly welcome. This program is brought to you by Ask Pediatricians Foundation. And we are committed to the health and to the well-being of all Nigerian children. All right, so I got a question already. Okay, Fama, good evening. So nice to see you again. Well done. Thank you. Thank you so much for joining me. Okay, Shukura Abu Abubkari. I hope I didn't mispronounce your name. Anyway, I'm sure I have the Shikara. Sorry for if I mispronounce your name. So good evening, ma. Please, can you use High's block on my baby immunization leg and how to care for baby 6 weeks immunization? Okay, thank you so much, Shikara. That's a very lovely question. So what we recommend is what we call high sparks. It's still the same ice block, but I don't expect you to go and take the a big chunk of ice block and put on the baby. You know those ice cubes that we normally put in our drinks. So you can put like 4 or 5 of them in an handkerchief and tie it, wrap it around in an handkerchief and tie it, and then you can just place it at the injection site. You are not massaging it, you are not pressing it, you just leave it there for 5-10 seconds and then you remove it. Then maybe after a couple of minutes again you place it there and you remove it. So that is what you do. We call it intermittent. You just use intermittent high spark on the site. It's just to cool down. Don't Most people make a mistake of rubbing the site. I don't know where we actually get the concept. I think it's a Nigerian or Yoruba thing, I don't know. We got the concept that when something is swollen we should rub it. Actually, that is actually the wrong thing to do. That's actually the worst thing you can do. When something is swollen, we're not supposed to massage it, we're not supposed to rub it. Okay, we're supposed to actually try and see how to get the swelling to go down. And so if you rub, because what is happening is that because the 6 weeks immunization, the penta, which contain DPT, Haemophilus influenza vaccine, and the hepatitis B vaccine, is a very deep intramuscular injection. So that injection will lead to a little bit of bleeding into the muscle. Okay, so what we're trying to do is to stop the bleeding, and so that the blood that has come out will go down. But when you rub, you're actually going to make it bleed more, and then it's going to swell up more. And if we don't even do it properly, we can introduce germs into it, and that is why children can have what we call cellulitis or frank injection abscess from poor management of the injection site. So it's a common thing for you to have a little bit of redness, a little bit of swelling, but what we need to do is just apply ice packs for intermittently and be very gentle. Most of us were not very conscious of the fact that this just child has had injections on their thigh. Usually they have like 2 because they will give the pneumococcal on the other leg as well. So they are sore, a little bit sore. So we should be very gentle. That's not the time you just carry their leg anyhow. Even when you are changing diapers or changing their nappies, you don't just move the leg anyhow or throwing them. You have to be very gentle for those couple of days after that immunization. Gentle handling of the legs, ice packs application, and you can also give paracetamol if you feel the child is in pain, or if they have fever, you can give them paracetamol every 6 hours. You can repeat your paracetamol. I hope you know the dose of the paracetamol. The dose of paracetamol is usually based on the weight of the child, but if you are not sure, just go by what is recommended on the ballpark based on the age. It is still going to be close, though not as accurate as using the weight of the child. I find a lot of mothers go for immunization, and then when they come back home, they actually don't know what quantity of paracetamol to give. These are some of the information you should have make sure you collect before you leave the immunization center. So always ask them, if my baby has fever, what should I do? Ideally, in those days we usually would have given all this kind of information to you at the health center, before or after the immunization. But I guess, maybe our health workers are too busy these days. I see a lot of mothers leaving immunization centers not knowing all these basic things, which we should have done before and after. In fact, sometimes some don't even know the immunization their children were given. I must say that this is one of the reasons why female education is a child survival strategy. Mothers must be educated. You must know what immunization your child is given. You must always let them tell you what you're about to give your child, and make sure it's the right age, because health workers are seeing so many children. Sometimes they can, it's not to give them an excuse or a pass, but we're all humans. Women error can happen. And I see a lot of mothers coming to complain, oh, they gave my baby the wrong immunization, blah, blah, blah. Please always check your immunization card. Know what immunization your child is going to take. That is why you're educated. That's why you can read. And then when you get there, when they're about to administer, what are you about to give? So that if there's going to be an error, you quickly nip it in the bud just before. And when you finish taking immunization, don't rush home. You must wait at the immunization center for at least 15 to 30 minutes, so that if in case your child reacts to the vaccine, the immunizations, healthcare workers, they know what to do, how to quickly react to any allergic reaction to vaccine. And then when you get home, you must know what to do. So I'm very happy you asked this question, because we get a lot of questions like this. And I think it's because we are not doing the right health education at the immunization centers. But anyway, that is also why I'm here. And I hope now you know what to do if your child has after your child has been immunized. So you know what to do. So, but if you still need any further clarification, please feel free to ask me. Adeleke Adechimoke. So, okay, happy new month to you too, man. Happy birthday in advance. Thank you. My birthday is a week to Christmas, so you can't easily forget. And unfortunately, ATP is also going to close, I think, on the 20th, the Saturday. So, and that will be all for this year till January 2026. So, thank you. If I'm asked question, I would like to know what maybe means to briefly twitch their leg while sleeping. Okay, I think we've answered these questions before. If I'm it's about what we call benign myoclonus of new, but it's just a minor thing. It's nothing to worry about, and there's nothing wrong with maybe moving their legs, or shaking their legs briefly, or shaking their hands. Usually it's happening in a couple of seconds and it's gone. It's not a seizure, so we're not worried about that. Yeah, there's nothing to worry about if a baby just twitch their legs, or while they're sleeping. No. What is the difference? How do you know if a child is having a seizure in their sleep? Usually when children have real seizures in their sleep, it will wake them up. Usually that seizure is severe enough, it will wake the child up, it will make the child to cry, and it will go on for, it won't happen in 1 second, it will go on for at least maybe 30 seconds, 1 minute, and you won't be able to stop it. It's going to be a very dramatic beginning and dramatic end. So that is how you know it's a seizure. Seizure is really a major thing. It's very dramatic. It's not going to happen in 1 second. It's minimum it will go for at least 30 seconds, 1 minute, and it will start suddenly, and it went suddenly, and it will really be obvious. And when you try to, sometimes the children actually will wake up from it and they will start to cry. And so it's usually, you can't miss when a child is really having a seizure. And if you try to stop the child shaking or anything like that, you won't be able to stop it. But a child who is otherwise sleeping, who does a little bit of shake of their hands or their legs, it's not a seizure. We call it benign sleep myoclonus, and it's nothing to worry about. Okay. Let me just check whether you Instagram people, if you have questions, feel free to ask your question and we'll answer them. Then you say, okay, I would like to know how we can protect our kids during the Harmattan weather. Yeah, Harmattan is our the closest for us in Nigeria to snow, to winter and snow and things like that. But basically, the weather is cold, the weather is dry, it's dusty, and everywhere is so dry. So the most important thing, number one, the skin. So we need to keep the baby's skins moisturized. So let's make sure we're applying the vaccine. Let's just apply. Sometimes they need to apply it several times a day. Just keep the skin moisturized. Let's keep the lips moisturized as well, so that they don't have broken lips and all that. Then let's try and as much as possible to let the children stay away from the dust and all those things, because we don't want them breathing in all those dusts and everything that happens in the midterm. So as much as possible, they can stay indoors. But if they have to go out, it's not a problem. But you just want to avoid them inhaling too much of the dust and everything. And of course, keep children warm. The weather is really cold, so let them wear their clothes, thicker clothes or layers of clothes, just to keep them warm. Let them drink a lot of warm fluids, eat hot foods and all that. That will keep them warm as well. So, yeah, a lot of cooking and all that goes on. So just make sure they avoid the smokes. Most of us go to the villages and we're using the firewoods and all those kind of things for cooking. We need to just try and keep the children away from inhaling those smokes, because the smokes kind of make the airway less effective in dealing with germs and all that. So those are the things we can do, really. Just basic common. We do all these things, like most mothers do it anyway. And then if you are going to go out of the, for our children who are asthmatic, we know that they are more prone to having attacks during this period. So let's make sure we have the inhalers available. Let's make sure if you're going to the villages, you know where your nearest hospital is, you know where to go if there's an emergencies and all that. Those are the things we need to do. But more importantly, let's just enjoy the weather, enjoy the season, and let the children have fun. Oh, thank you. Thank you, Fema. Happy new month to you as well. Okay. Zilly Bliss. Happy new month to you as well. Instagram people, no question. Good. My baby didn't receive rotor vaccine. Yeah, sorry. At 10 weeks, 14 weeks, it wasn't available. Yeah, we knew that we didn't have some. Sometimes we run into what we call vaccine shortages. So apologies about that. Your question, can he still receive it before 6 months? Yeah, your baby can still receive it whenever it's available. Some people even stretch it as long as baby can see in the first year, they will still give it. But the rota vaccine protects against the rotavirus infection. Rotavirus is the commonest cause of diarrhea and vomiting in children under the age of 5. So it's a very common cause of this diarrhea and vomit. Even despite all your hygiene and everything, children can still have rotavirus infection, and then they will have diarrhea and vomiting. So we are giving rota vaccine to protect against the rotavirus infection. And rotavirus infection tends to peak between 6 and 11 months. So most of the vaccines, ideally, we should have given it, that 6, 10, 14 weeks, so that before the 6 months, when the child is likely going to have the infection, they are already protected. So that's why, for me personally, giving rotavirus vaccine after 8 months, it really doesn't do much. But some of my colleagues will say, even if it's still in the first 1 year, we can still give it, because your child is still exposed to rotavirus for the first 5 years of life. So they can still have the rotavirus infection. So giving them, it still protect them a bit. But the peak period when we expect children to have this rotavirus infection is between 6 months and 11 months. So we really preferably give it before that. And so giving it after that, it doesn't really do much anymore, because the peak period where we are targeting is between 6 and 11 months. But I would say if it's still available, you give it. But usually after 1 year, I'm not going to buy that anymore. So these are one of those vaccines that we have a timeline to. So there are certain vaccines that anytime your child can still always take them, So things like BCG, if your child needs BCG, no matter what time of life you present to us and the child has not taken BCG, we are going to give the BCG. So there are vaccines like that. They are like yellow fever vaccine, even hepatitis B. We're always going to give it because even as an adult, you still need it. But there are certain vaccines that once you miss the period that is relevant, we're not going to repeat it again. So Rota is one of those vaccines. We want to give it in that before that first 6 months. So after 1 year, Rota is really, really no longer relevant. There are also certain vaccines that we want to give in the first 5 years of life. So if you come after 5 years, is we are not likely going to bother giving it anymore. So, but most vaccines, if you mix them, you can always take them uh, whenever you show up, we'll still give the child. But there are a few of them, like Rota especially is one of them, that after 1 year, it is no longer a vaccine of importance to us, so we may not bother giving it at that time. Okay. I hope I answer all your questions. Yeah, okay. Yeah, you can give it if you can just be checking with your health centers if it's available, you can go get it. And if not, you can buy it. I hope you know you can pay for it and get your own. You can buy it from pharmacies, they will sell to you. So if the country does not have, you can go buy it or go to private hospitals, they give it. Of course, you're going to pay for it, but if you don't want to, it's not really too much of an hassle. Rota, children have diarrhea and vomiting, but it's not like one of the major killer ones like BCG, measles, and all that. So it would be nice, but if not, I won't really. If you can afford it, why not? If not, I won't really stress over it. That's just that. Okay, it says RSV vaccine available in Nigeria is not, obviously not. Even in the places where they are making it, I don't even think UK have it completely now. It's just being introduced even in advanced countries. So not to talk of those of us, we're always like we're always like the last to get things like that. But I'm not even sure we are going to prioritize RSV vaccine. I think we are trying to prioritize malaria vaccine. So the what vaccine you should be looking out for in Nigeria is the malaria vaccine. Number one, it's already been rolled out, and I think some children may have taken the malaria vaccine. So malaria vaccine first. Maybe down the line we may think of RSV, but definitely it's not our priority right now. RSV is not available in Nigeria. Rota was not doing that, and they said it. Who are the who is it there? So don't take any word from anybody. The only people you should listen to when it comes to immunization, you listen to the pediatricians, you listen to the Nigerian primary healthcare development agency, and they're on Facebook, they're on social media. So if you didn't get that information from the Nigerian PHCDA, please don't take it. Don't take it at all. Don't listen to anybody that is not representing the government when it comes to things like that. Okay, so if you have any question, Instagram people, ask your question and then I will answer them. Okay, Shukura, I've answered your question. Zilly Blaze say, is he advisable to travel by road with a him? Okay, you are saying also is he advisable? So what was your first part of your question? So are you talking about your sis? How old is your baby now? You didn't tell us the age of your baby, but you just say his next appointment is okay. It'll be 4 months this December, and so we get a lot of questions about traveling by road. There's no law against traveling with children by road, but you just have to apply as much. The most important thing is that you are keeping the child comfortable. You are not exposing them to, like I said, dust and stuff like that. So we don't say you cannot travel by road with children, but definitely children cannot stand very long journey. And if you so most time you may have to break your journey. You have to make sure the children are comfortable. If you are going to travel by public transport, that may be a bit challenging. But if you are going as a family, traveling by your own car, definitely you can, take maybe every 2 hours you take a break, and all that. Most time children sleep throughout the journey anyway. So just make sure you have everything. For your 4 month old, I believe you're going to just breastfeed the baby. And make sure you are not opening the windows to expose to the doors and all those stuff. So really, so if you just take all your necessary precaution, why not? But if you can go by the shortest way to go on those kind of journey, I would recommend that. In other words, if the shortest way is for you to fly rather than go by 10 hours on the road or 12 hours on the road, I'll recommend you fly. But if you have no option than to go by road, then make sure you break the journey, make sure you have everything the child will need, make sure the children are protected and not exposed to dust and cold and all that. So just basic precautions, and it's fine. But I personally just felt that this is not like a law, it's just general recommendation. Like if you don't have to take a child on a long journey, if it's not like life and death, or if it's not essential, then don't. Just stay. It's better kids stay at home, they are safer there. But if you must take that journey, then go by the shortest travel time possible. So in other words, if it will be faster for you to travel by road, by air, then you go by air rather than by road. But if you have to go by road, then try and make sure that the journey is as comfortable as possible, and try and make sure you have breaks in between the journey and all that. And I hope you're not driving, because if you're the mom, you may want to breastfeed, so somebody else has to drive. So those are the common precautions, but otherwise it's just basic common sense. Then there is no particular law or health reason. Just as long as you're taking precautions, that's fine. All right. Let's continue. I think at 30 minutes, I'll just talk a little bit about pediatric HIV/AIDS, and then I'll move on. Bioluati Fair, my baby of 7 months has rheum. What is rheum? Coming, okay, something like a high discharge coming out of his eyes consecutively. What do you mean by consecutively? Okay, I keep cleaning it, but it hasn't stopped. What was the color of the discharge? Is it white? Is it yellowish? And is it gumming the eyes together? What's the white part of the eyes? Is it looking red? Is it itchy? Those are the kind of things that we want to know about the discharge. So you've been to the hospital, you've given antibiotics. Yeah. Did they give you antibiotic eye drop? Or was it only just oral antibiotics? Those are the questions I need to clarify. So, Bill, if you are listening to me, just give me the answers to all those questions I've asked you. So, how long has this discharge been there? What's the color of the discharge? Is it gumming to the eyes? And is the eyes red? Is it itchy? What drugs have you given? Did they give you an antibiotic eye drop? Did you use it for the duration you were asked to use it? And then we can now answer your questions. Because basically, if your child is having high discharge, it means there's an infection. It could be viral, it could be bacteria. The number one thing that you need to clean is with clean water and clean clothes, and make sure you wash your hands. Two, if it's something that's been going on for so long, we may need to take a little bit of that eye discharge and send it to the laboratory. The lab will test it for us, and then the lab can tell us what particular germ is causing that eye discharge. And the lab will also be able to tell us what best antibiotic we should use to treat it. And most of the time, if it's an eye infection, most of the antibiotics we give it as an eye drop into the eyes. And most of the time, what I found out that sometimes parents, when we begin to apply the eye drop and the discharge stop, we kind of just stop treating the child. No, if the doctor has said you must give the eye drop for 7 days or 10 days or even 14 days, you must finish it, even if the child is no longer having the eye discharge. And then when you are doing the eye drop, make sure you don't touch the dropper. Make sure you don't use it to touch the eyes, because that is what some of us do. Because if we do it that way, it is going to contaminate the dropper. In other words, you have transferred the infection from the eyes to the dropper itself. And of course, if you now use it on the other eye, it's just going to be a vicious cycle. So make sure you just drop it, and you don't allow contact between the eye the drop of the eye drop and the height itself. And you must always maintain hygiene, washing your hands regularly with soap and water, washing the child's hand, because sometimes they keep putting the hands in their eyes, and that will be reintroducing the infection as well. So you just need to do all these right things. And if the pediatrician has treated you and there's no improvement, they can always refer you to see the eye doctors, the ophthalmologists. These are the experts. They are. Sorry, I think I don't know what I pressed and I went off. Anyway, but those are the extra. When I was saying that if the pediatrician has been treating your child and there's no improvement, then they can refer you to the ophthalmologist. The ophthalmologists are the experts when it comes to the eyes, so they can take it further, you know, and treat it further. So I don't know whether Boluwatife, you are still listening to me. If yes, please put in the updates I've asked you, and then I can always response to that. I hope. Okay, Ozavis V. Okay, V. Let's just take the V. Okay. How do I care for my 2 month old? She's having catarrh and it's affecting her feeding a bit. Not really serious yet. Okay, so most catarrh, like that's nasal discharge and cough sometimes with it in babies at this age is due to viruses. So most of them don't require any particular treatment, and they are going to go by their on their own. They will run their course and then they will go away, so you don't need to do anything about them. What we recommend is that you keep breastfeeding your baby exclusively. You try and keep your baby away from people who have cough and colds, because usually that is how babies get them, from maybe siblings, from all your visitors coming, they cough and sneeze on the baby. That's how the baby gets all these viruses, and that's how they have all this infection. So but we recommend that you breastfeed your baby exclusively and keep baby warm, obviously, and that is all you need to do. But if the baby is having fast breathing or difficulty with breathing, in addition to the catarrh itself, or the child also has fever, really if it's high fever, you need to take the child to the hospital, because that may be more than something that is just a virus. That may have been a bacterial infection or pneumonia, and we may need to treat the child with antibiotics. So depending on which one it is. So if it's just a nasal discharge, you can just clean it. If as long as it's flowing out, you can just clean it. Keep breastfeeding your baby. Usually between 10-14 days, most of them will clear on their own. But if the child is having fast breathing, difficulty with breathing, the child is having high fever, then you will need to take the child to the hospital for us to treat the child. But more importantly, prevention. Keep baby away from adults, siblings, people who have cough and cold. Keep baby away. Hygiene, hand washing with soap and water. Remember what we always do during that COVID period? Exactly the same thing. Don't take baby to the kitchen. Don't take baby near people that are smoking, or people using the generator fumes, or even you frying stuff in your kitchen. You take baby away from those kind of stuff. Exclusive breastfeeding. Those are the things that will protect your baby. And of course, I hope your baby is getting all the immunization. You should have gotten your 6 weeks vaccines by now. So those are the things you can do to keep your baby protected against all these viral infections. And yeah, I hope that's helpful. Um, okay, thank you for your greetings. Blessing Isioma, say thank you for what you do. I'm concerned about baby's weight, okay? Is there anything to worry about? What is the weight? Birth weight is 3.3, okay? 10 weeks is 4.3. That's fine. That's fine. And 10 weeks, you jump 6 weeks. Okay, anyway, no problem. 4.3. Okay, then 14 weeks is 5.6. Not too bad. And 6 months is 6.3. Okay, your baby's weights are fine. Completely okay. So we expect your babies to double their birth weight at 6 months, 5 to 6 months, and your baby has done exactly just that. So we are not worried about your baby's weight. Your baby's weight is actually on point. So just keep breastfeeding exclusively. Now that your baby is 6 months, you can now start giving um complementary food. I hope you know how to start and how to go about complementary feeding. If not, if you go to our Facebook group, Ask the Pediatricians, we have what we call the guide section, and in that guide section we have all those videos on how to go about complementary feeding and all that. So you may want to watch them, and then you may want to start feeding your baby, but the weight is absolutely okay. And of course you keep breastfeeding as well, so just be mindful of the fact that um um the fact that you start complementary feeding does not mean you stop breastfeeding. It means you keep breastfeeding, but breast milk is no longer going to be enough at 6 months. And so in addition to breast milk, you are also giving other food. So that is what it means. So I hope you have gotten that. So there's nothing to worry about. I'm perfectly okay with your baby's weight. All right. Okay. I don't think I have any question for now. So I'm just going to talk about the World AIDS Day. Let me just check Instagram. Instagram people, no question. If you have any question, feel free to ask. I hope I didn't miss anybody's question on Instagram. Okay. So today, every December 1st of every year is what we call the World AIDS Day, AIDS. Okay, or all of us are familiar with HIV. So that's the day in the year that will try to create awareness about HIV/AIDS and the rest of them. Luckily, HIV, when I was in medical school, when I think HIV was becoming rampant at that time, and I remember it's almost like a death sentence, and we were seeing people who have HIV and they go through what we call the AIDS. You see those pictures where they will lose all, they are very skinny, they are dying, and people were dying so much at that time. But now a lot has changed now. Now HIV/AIDS is almost like a chronic disease. It's almost like the same thing like having tuberculosis or having what's it called, having hypertension or diabetes. That is how HIV is. Thank God for what we call the antiretroviral drugs, highly active antiretroviral drugs. They've really, really changed the landscape now. So many people these days now living conveniently with HIV/AIDS, and they are fine. Most people just have HIV. In fact, we are getting to the point where people are becoming zero viral load, and almost like we're curing HIV. So we've really gone through a stage where once somebody has HIV, it's almost like a death sentence. Whereas right now, it is almost like a chronic disease. But all the same, we still want to end AIDS. We still want to we want our we want as many people as possible to be HIV free. Okay. And now coming to pediatrics, luckily we've also been successful with our what we call prevention of mother to child, because majority of our children get HIV from their mothers, because when a mother is HIV positive, she's likely going to transfer the HIV to our baby if we don't take precautions. But luckily for us now, with the advent of also highly active antiretroviral drugs for the mother and even for the baby, we are now having a lot of children that are born even to HIV positive mother who don't have HIV. And even some of them are breastfeeding their babies and the babies still don't have HIV. So that is a very massive progress. And also we become safer with our blood transfusion. So before children are transfused with blood, as much as we don't want to transfuse anybody with blood, but if we have to transfuse them with blood, we make sure that the blood is screened properly, screen for HIV, hepatitis B, and hepatitis C, and make sure it is all negative before we give the blood. So we've seen so much massive reduction in terms of cases of HIV, but that does not mean HIV is still not there. It has not yet completely disappeared. So we still need to make sure that we focus on prevention. And like I said, for our children, 90% of our children get their HIV from the mothers. So how do we protect our children from HIV? Is by making sure all pregnant women are screened for HIV, when they register for antenatal, one of the tests we want you to do is HIV test. So that if it's just, this is not about stigmatization or anything, it is so that we can start putting in all the measures to make sure that that baby will be born without HIV. And what are those measures? We make sure that the mothers are given antiretroviral drugs throughout the pregnancy. And when the baby is born, we test the baby, and we also give the baby antiretroviral drugs as well for the first 6 weeks. We say the mother should breastfeed. Initially before we say mother should not breastfeed because breast milk can also be a way of transferring HIV. But nowadays, with the concept of antiretroviral drugs, mothers who are actually taking antiretroviral drugs can breastfeed the baby exclusively, because we actually found that more babies are dying not from HIV/AIDS, they are dying from diarrhea, from the formula feeding, not from HIV/AIDS. So these days we've changed now to the fact that mothers can breastfeed, but they need to be taking their antiretroviral drugs, and then they can stop breastfeeding, and then baby will be on complementary. And then usually we will test the baby again around that 1 year, 18 months, and then most of them are HIV free. Good. But once in a while, we may still have children who maybe the mother didn't book on time, they didn't take antiviral drugs, whatever. The baby could still have HIV. And then we can, for those kind of children, we can now start treating them, and most of them do well. Antiretroviral medications available for children and all that. So we're actually going towards where we want zero, like zero HIV. We're going closer and closer to where no child will have HIV either from the mother, and like I said, all the other methods, through blood transfusion, we're also working on that. And I think the only other method that people don't know is exposure to sharps, because children sometimes they're so inquisitive, they want to play with blades, they want to play, we need to be careful, because you don't, like we used to say in those days, HIV, the right time for forehead, you don't know who is HIV positive. So you want to avoid children coming in contact with other people's blood or body fluids. So we need to be careful. Let's not make sharp subjects like blades and stuff readily available for our children. Let's make sure we are very careful so that they don't get themselves injured and get themselves contaminated. If possible, let your children have their own clippers, things like that. Let them not share it with other people. When you go into the shops, to the barbing salon, go with your own clippers and let it be sterilized. So those are measures that we can put in place to make sure that our children do not contract HIV, outside through all these things that we do, procedures and stuff like that. So we're looking forward to that day where we have zero pediatric HIV/AIDS. If you have any question about HIV, feel free to ask and I will answer them. But I just want to create a little bit of awareness, because today is the World HIV, World AIDS Day. So that's but that's not the only thing I'm talking about. Feel free to say ask your question. Okay, Bolowatife is back. Maybe of 7 months. Okay, you've asked your question. I did ask you some question. Thank you for all you do. The discharge is light yellow. So yellowish eye discharge is most likely a bacterial infection. Another one, as I clean it, another one follows. Yeah, so that means the child is having discharge. Yeah, we're only giving oral antibiotics. So no, usually eye discharge or high infection is not treated with oral antibiotics. I doubt you very much whether you saw a pediatrician. Most likely, maybe you just saw one of our general doctors. So you really need to go back to the hospital. I hope did you catch all the things I said about cleaning, hygiene, washing your hands, the how you apply the eye drop. I hope you were still listening to me at that time. But you need to go back to the hospital. You need to see preferably a proper pediatrician or an ophthalmologist, an eye doctor, so that they can. Usually, the minimum I would expect them to do is to take a swab of the eye discharge and send it to the lab and test it. Usually the result may come back in 2 3 days, but before then we can start eye drops. We start with the common ones, and then if when the result come out, if the what we are using is also good among the antibiotics recommended by the test, we'll continue. If not, we can change it to one of the ones that are recommended, and and then but like I said, you must make sure you complete the treatments, and the way you clean the eye discharge, so you must clean clothes, clean water, and you must always wash your hands in between, and wash the child's hand, because they also put their hands in their eyes. So those are things you need to do. I don't know why they were giving you anti-malaria or antibiotics for a child with high discharge, unless there are other issues with the child different from the eye discharge, but that is how we manage it. So if you can go back, it has not been properly managed. I think that's what I'm just going to say. So you feel free to go back, and then that will be done. Okay, Aguloye Olubumi, good evening, happy new month. I saw some ingredient like color, preservative, blah blah blah, was used to make the food. Is that the kind of ingredient good for my baby? Is 6 months old? Okay, so there are some items that so number one, the product you are looking at, is it NAFDAC approved or not? That's first thing you want to check. So that is why we have the Food and Drug Administration, what they call them, council, whatever, National Food and Drug, I've forgotten the full name of NAFDAC and all that. But basically, every country will have that kind of food and drug organization that monitors all these things for us, because all of us cannot remember everything. We cannot always remember to go and check, But luckily now we have AI, so you can always ask AI. So there are some additives that are approved, and they are okay for people to eat. So that is why that's the job of that is what people like NAFTA could have gone through to make sure that whatever is in that product is okay. But to avoid all these kind of questions, the best thing is okay, National Agency for Food and Drug Administration and Control. Okay, I got it now. Okay, so but what is the best option is actually for you to give your child your own cooked food from your own kitchen. That way you won't have to worry about all these additives. So why not make your own pap? Why not use your own raw whatever, your raw yam, your potato, your own egg, your own maize or guinea corn, whatever. You can make all this thing from scratch by yourself. That is healthier, and so there's no food your child is going to eat at 6 months that is not in your kitchen, really. So, and it's better and it's safer that way. The one that is manufactured in the industrial kitchen, it's not as if there's anything wrong with them, but they have to be preserved. So some of those things, they add them for color, some of them they add it for preservatives and all that. The job of NAFDAC and all the FDA is to make sure that whatever they are adding is fit for human consumption, and the quantity they are adding is just about the quantity that is okay for human consumption. So yes, that is the job of NAFDAC, to safeguard us. But I will always say that to avoid all this, and if you can do things from your own kitchen, it's better. This better than buying tin or store products. Your own kitchen is the safest place to make food for your baby. But for everything they add to those products, if the product is licensed by NAFDAC, it means somebody has checked for you and it should be fine. But if you are not sure, you can also pop in those names into Google or whatever, any of the search engine, or ask AI, and it will tell you what they are and whether it's safe or not. But like I said, if you can just avoid them completely, that will be the best option. I hope that's helpful. Your baby is the weight is okay. You know, your baby is really big. Your baby has been big from the beginning. Your baby was 4 kilo at birth, so we call it macrosomic baby. So that's the baby who is big for age, and now your baby is 8.2. It's also very big still. So just make sure that as you're starting complementary feeding, you are not don't overfeed your baby. Just make sure that you're doing the right quantity and frequency, and just keep breastfeeding in addition to the complementary feeds. But you need to keep an eye on your baby's weight. Your baby has always been big. Usually would should have done some basic investigation, as pediatrician. But if you are from a family where you are all big and things like that, it may just be genetic, but we just need to keep an eye on that. Hope Omije, good evening. Hope, how are you? My When a baby react to food, how will you stop the reaction? Okay. The first thing you need to do is to stop the food itself. So, and this is the same principle that applies to all allergy or all reaction to anything. Children can react to anything. People can react to water. They can react to food, egg, fish, nuts, especially peanuts, all those nuts. So children can react to them. So if your child reacts to anything, you must stop giving your child or exposing your child to that particular thing. That is the first and foremost thing you want to do. Then you need to be sure first that the child actually reacted to the food, because there are other things that could have happened. And it's really when we are eating the kind of food that maybe that is we bought, it means there may be many things in that food at once. So you will not be sure which one out of all the things you mix together is the child reacting to. Is it the egg? Is it the fish? Is it the nuts? Maybe use groundnut oil, for example. So you are not sure. So sometimes it may be good to see the allergic doctors, and then they will, if the reaction is very severe, you have to actually go to the hospital. So sometimes some people, you should stop the food or the drug, whatever the child is reacting to, the reaction kind of stop, and that's it. But some people is really very bad. You can even have very severe, what we call anaphylactic reaction, in which case the child can collapse and the child is an emergency, basically. So, but it's always good to go to the hospital. With doctors, we have what we call anti-allergy medication. We can give some injections, we can give some steroids, we can give some things to kind of bring down the reaction quickly, or the response to that allergy. We can do some things about it, but the most important thing is to avoid. Avoidance is the key word when it comes to allergy. Just avoid whatever the child is allergic to. Sometimes allergy doctors can do what we call allergy challenge, in which case they try to reintroduce the child back. For example, milk. Some children may be allergic to milk, cow milk, protein allergy at the beginning, but then they go through what we call a milk ladder, and they begin to reintroduce them back to the milk again, and they're actually fine, and they begin to tolerate it, even though they reacted when they were younger. So some people like that, but some people with very severe allergy, they can never go back on that food. So that is the job of our allergy doctors, to work with the child and help you. So whether it's something they can re-challenge, or whether it's something you should always avoid, depending on the level of severity of the allergy. So so you just have to see the right specialist. Most of them are in the teaching hospitals. Okay. Toyin Ogungbemi. Good evening. What causes baby to be pulling the exact food eating? Can you be specific with the age of the child? Okay, so there's what we call toddler's diarrhea. So children between the age of 1 to 3. Sometimes they eat the food, especially when you start complementary feeding, and they can pass out exactly. Maybe they eat rice, and then you will see the rice in the stool, or the head beans, and you will say it. So we call it toddler's diarrhea. It's just a passing phase thing. It's not something to be worried about. Most of the time, sometimes there's what we call rapid transit time. In other words, when the children start eating the food moves very rapidly down the intestine and come out without going through the digestion. So that is what happened. And it's nothing to worry about. Or sometimes there are some things we give our children that actually their intestine could not digest it. And so sometimes some vegetables, some of those things they come out like that. But usually it's just something that happens maybe once or twice. It's not something that will continue for a long time. So it's nothing to worry about. You don't need to do anything about it. You can encourage the child to eat the food slower, chew it thoroughly, and all that. But it's something that it will just stop also on its own. It's nothing to worry about. But we call it toddler's diarrhea, which is a kind of a misnomer because it's not really a diarrhea. It's just food that has gone through the intestine rapidly without enough time for it to be properly digested and all that. But it doesn't continue for a long time, so we will not worry about it. Yeah. Yeah, okay, yeah. So your child is 1 year old. Yeah, so it's toddler's diarrhea. Just try and slow down your child to eat a little slower. Try and make sure the food is properly mashed as well. Especially for this age, make sure because they may not be able to chew, they just kind of swallow it and they rush it through. And sometimes some of us because we're also rushing, we have other things to do. We don't so let the children learn to chew and savor and eat a little bit slower. For you can match, you can puree, those also may be helpful. But it's something that will stop. It's nothing to worry about. I guess it's worse in some children than others, but nothing to worry about. All right. I think our time is almost gone. Instagram people, I didn't see any question from you, but if you have any question, feel free to say ask. So today's What AIDS Day. So if you want to remember what to remember December 1st for is What AIDS Day, and we're working hard to get to zero HIV. We want no child to have HIV because they get it from their mother. That is what we are really, really working at towards. So hopefully, and thank God most of the adults too, they are not that very sick. But if you have an adult with HIV/AIDS, I mean, just go for treatment. There's treatment, there are drugs, so it's almost like um it's like a chronic disease, just like people who are taking drugs for their HIV, for their hypertension or diabetes. That's the same way. That's the same height now we are now looking at HIV, which is amazing feat of medical science. Because when I started my house job, I could still remember one of my few patients, dying on the wards, and I remember people used to be so scared to go near, people who have HIV, and those of us who are young doctors then would be so scared of pricking ourselves, and you prick yourself, then we also have to go on treatment, what we call the post-exposure prophylaxis. It used to be so scary then, but luckily nowadays that is not the issue. We've really come a long way. We really come a long way, and that is quite reassuring. But all the same, you should still take precaution. Please avoid blood transfusion if you can. If you for the adults now, I'm talking for the adults, and if you going to get blood, make sure it is screened, sexual, let's try and keep to our partners. Just keep to one partners and make sure your partner is also HIV negative. And of course, if you are not sure, of course, use prevention, use contrast, use your condoms, whatever you need to do. Abstinence, we preach for the youths and for the adolescent, but if you can abstain, make sure you are faithful to your partner, ABC, and say you can use condom. And then if you are not sure, you can get tested. If you're tested, then they can give you treatment. I think before, I'm not sure whether we recommend routine testing now, but usually for the pregnant mothers, we always will test you because we need to be sure whether you are negative or not. And if you are positive, we need to start you on antiretroviral drugs, not only for your own sake, but for the sake of the baby, because we don't want that baby to have HIV. And for children who already have HIV, there's treatments. We have treatment. Unfortunately, they just have to take those drugs for life, but they can live normal, healthy life despite HIV, with the right treatment. So thank you so much, everyone, for joining us. Welcome to the month of December. It's the most wonderful time of the year, and ATP will be closing on the 28th of December. So we just have about 3 weeks, and then we'll go on a break and we'll resume. Yeah, we're closing on the 28th of December, and we'll resume in January. I think we'll be resuming January 5th or thereabout. So thank you so much. And if you still have any question, remember we have our group opened Mondays to Saturdays. Our group will not be open when we are closed from the 28th, but I'm sure you will still have. You can always search your question on our Facebook group, and you always get your answers. But for now, if you have any questions after this live session, feel free to go to our Facebook group, post your questions there, and we'll try and answer them as soon as we can. Thank you so much. Have a wonderful evening, and it is bye bye. Bye bye. Bye.